Hi, my name is Robert, student of Nightingale College. Today I'm going to be administering or doing a remediation video for administering medication. First things first is I'm going to get to the facility. I'm going to wash my hands. I am going to review the electronic health records with the physician's orders. And from there, after reviewing the electronic health records with the physician's orders, I am going to compare and confirm the 6 rights. And what that is I'm checking for the right medication, the right patient, right medication, the right dosage, the right route, the right time, and the right documentation. That looks good with the electronic health records and the physician orders. Now I'm going to also compare the 6 rights with the medication administration records and the physician orders. Checking for the right patient, the right medication, the right dosage, the right route, the right documentation, and that looks good as well. So before I go to pull the medication out of the med cart, I'm going to first wash my hands. After I wash my hands, I'm going to go ahead and pull the medication. The Mars that I'm going to be using for this procedure or for this video, I'm going to be giving Ducoside sodium. It's going to be 100 milligrams of the Ducoside sodium. For the warfarin, it's going to be 5 milligrams of the warfarin. Furosemide is going to be 20 milligrams of the furosemide. Potassium chloride, that's going to be 20 mEq, which is going to be 20 milliequivalents. For the liquid medication, it's going to be acetaminophen, and that's going to be 500 milligrams, 15 mLs of the acetaminophen. So everything looks good with the checking the 6 rights of the the medication administration records and the physician's orders. And I'm going to be doing that check. That particular check is going to be at least about 3 times. That is time number 1 as I compare the medication on the the medication administration records and against the meds. That looks good. Now from there, I'm going to gather all my things and go into the patient's room. I do have my liquid medication I'm bringing with me, and I'm bringing the 4 tablets. I have gloves I'm bringing with me, and I'm bringing a cup of water for the patient, and as well as a napkin. I'll explain the napkin later on. I'll gather my items, go into the patient's room. Hello, Mr. Jones. My name is Robert, student of Nightingale College. The reason why I'm here is that I'm going to be administering oral medication. There's a doctor's order for you to have oral medication. So before I begin, I'll go ahead and wash my hands and pull the privacy curtain for you. So first, I'll put these items down on a clean, dry surface. Put them down, pull the privacy curtain, go and wash my hands. Now that my hands are clean, I'll come back, I'll check the patient, check his ID band. Mr. Jones, can I please see your ID band? And can you verbalize your full name and your birthday? Mr. Jones will tell me his name. His name is Raymond Jones, birthday March 10th, 1975. Good. Now that I confirmed Mr. Jones' birthday, I'll ask, Mr. Jones, do you have any allergies? Mr. Jones confirmed that he has no allergies. No seasonal allergies. Are you allergic to any medication or any foods? Once again, Mr. Jones confirmed he had no allergies as well. Mr. Jones, before we begin, are you okay with drinking water with your medication? Yes, Mr. Jones will drink water. He confirmed that. Now, let me go ahead and raise the level of your bed for him to be able to take the medication. Are you comfortable in this position? Yes? Okay, good. Now from there, I'll go ahead and wash my hands again. Good. And now that I confirmed the patient's ID band, I'm going to go ahead and compare the medications with the ID band and with the MAR. Compare the 6 rights to that. Everything looks good. That is safety check number 2. As I said, I'm going to do this 3 times. Now, hand hygiene real quick. So, Mr. Jones, I'm going to go ahead and go over the medication, and I'm going to put on my gloves. So I will explain to Mr. Jones the medication. Like the first meds he's going to be taking is going to be the Ducoside sodium. I would explain that the mechanism this medication is prescribed as a stool softener. What it does is the mechanism of action that it incorporates water into your fecal mass to soften it up so that you're not giving any hard bowel movement, right? I would explain to Mr. Jones that the contraindication for this medication is if he has a history of hypersensitivity, we will not give this medication. If he has abdominal pain, we will not give this medication. Or if this medication, if he has nausea, we will not give this medication. I would also explain to Mr. Jones that some medications may cause side effects and that it's important for him to let us know if he has any side effects. Side effects for this medication could include diarrhea, it could include a rash, or it could include abdominal pain. I would explain to Mr. Jones if he has any of those side effects to let us know as soon as possible. Mr. Jones, do you have any questions about that medication you're going to be taking, the Ducoside sodium? No? Okay. Another med you're going to be taking is going to be the potassium chloride. You're going to be getting 20 megs of the potassium chloride. That's 20 milli equivalents. This medication is used to treat low levels of potassium. There are side effects to that medication and also contraindications of that medication. One of the contraindications for that medication is that if you have kidney disease or if you have hyperkalemia, we would not give that medication, meaning that your potassium levels are already too high. That's what hyperkalemia is. Side effects of this medication includes vomiting, nausea, and upset stomach. Do you have any questions about this medication? No? Okay. Then I'll go on to explain to Mr. Jones that he's going to be getting also furosemide, and that is, you're going to be getting 20 milligrams of furosemide. And what that does is the doctors will prescribe that medication to treat edema that is due to heart failure or renal disease, or even for treating, this medication is used for treating hypertension. There's side effects to this medication as well, and contraindications of this medication. If you have anuria, that's a contraindication. We will not get that medication. If you have a history of hypersensitivity, we will not get that medication. And if you have a hepatic coma, we will not get that medication as a contraindication. I would explain to Mr. Jones that there are side effects, and that's orthostatic hypotension. Meaning that we will also remind Mr. Jones that because of the orthostatic hypotension, it could cause him to be to get dizzy as he's getting out of bed. So we'll advise him to move slow as he's moving around. Hyponatremia is another side effect. Do you have any questions about that medication? No? Okay. Another one you're going to be taking is going to be warfarin. You're going to be getting 5 milligrams of warfarin. The mechanism of action for this one, it is an anticoagulant, and it is prescribed to prevent blood clots. For this medication, side effect of this one is hypotension, bleeding gums, and hematuria. So for this medication, I would remind Mr. Jones that to use an electric razor instead of a regular razor. And then also it could cause hypotension. So because of this medication could affect his blood pressure, also as well as the last medication, the furosemide. Because of these two medications, I'm definitely going to be checking the patient's heart rate, and I'm going to be checking the patient's blood pressure, making sure that the blood pressure level is not too low. That way, when we're giving this medication, it does not affect the patient's, dropping the the blood pressure or the patient's heart rate. So we want to make sure that those are already at a healthy levels. Contraindications for this medication is GI ulcer, or if you have liver and kidney disease. That's a contraindication of this medication. And do you have any questions of this meds, or any of these medications? No? Okay. So now from there is, before I go ahead and put the medication in a cup, I'm going to check one last time and check each pill against the MAR, the medication administration records. I'm checking each pill against it, put it in the cup. Check another pill, put it in the cup, check the other ones against it, put it in the cup, and I'm checking for the 6 rights. That's going to be the right medication, the right patient, the right medication, the right dosage, the right time, the right route, and the right documentation. So I'm checking all these. Everything looks good from there. As I'm confirming, I'm checking it against the MAR, putting it in the cup. When it looks good with the 6 rights, go from there, and 6 rights, then put it in the cup. Okay, now for the liquid medication, you want to shake it first, shake the medication first, and I want to also check that against the 6 rights right before I put that in the cup. Now this one you would always pour at eye level, and it's a good thing that most med carts are a little bit higher. So you want to get down to that level, and then also be mindful that you want to also palm the label so that you don't pour it against the label, because you want to protect that label. The cap you want to put facing up, and you want to pour 15 mLs of this medication. 15 mLs, good. 15 mLs. Alrighty. All right, so there's 15 mLs. Let you see that there. There you go, 15 mLs. And from there, you want to also be mindful that before I put the cap on, I would also make sure that I wiped around. When the cap was still off, I would have had, just want to make sure I touch on this, I would have wiped around the cap, the top, right? Wiped around the top and then put the cap on, right? Making sure that there's nothing there, right? To protect the label, right? Then so from there, I'll go ahead and give the patient his medication, pour the pills, and then here's the water. There you go. Good. Here's a little bit more pills right there. And there's your water there. Then from there, I'll go ahead and here is your liquid medication, right? Patient took the liquid medication. Then from there, I'll go ahead and I'll ask the patient, are you okay? Good. All right. I'll provide the patient his call aid. I'll clean up this area here. I'll go do hand hygiene, and then I'll go wash my hands. Hand hygiene, wash my hands, and I'll go document the medication I just gave. Thank you very much.